Warahmatullahi wabarakatuh. Good afternoon, ladies and gentlemen, and welcome to the webinar series of Research Capacity Building brought to you by Master Program in Public Health, Master Program in Health Policy and Management, and Health and Demographic Surveillance System Sleman, Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada, Indonesia, and in collaboration with University of Gothenburg, Sweden. Ladies and gentlemen, this is the first webinar series, and today's event would be all about the research proposal. And as you may know, there will be two invited speakers for today's webinar. There are Professor Nawi from University of Gothenburg and Ibu Dr. Ifta Choiriyah from Universitas Gadjah Mada, Indonesia. And our moderator today would be Ibu Vicka Oktaria, Medical Doctor, Master of Public Health, Doctor of Philosophy. A brief information about Ibu Vicka, ladies and gentlemen. Ibu Vicka is a lecturer at the Department of Biostatistics, Epidemiology, and Population Health. She got her medical doctor here at Universitas Gadjah Mada, Indonesia, and her master and doctoral degree from University of Melbourne, Australia. Her research focus will be about the epidemiology of childhood diseases, including acute respiratory infections, infectious diseases, vitamin D deficiency, vaccine-preventable disease, vaccinations, and implementation research. Currently, she is working on several projects, and one of those is the SARS-CoV-2 surveillance using wastewater and environmental sampling in Indonesia, in collaboration with Murdoch Children Research Institute and Monash University. Without further ado, ladies and gentlemen, please welcome Ibu Vicka Oktaria, Medical Doctor, Master of Public Health, Doctor of Philosophy.
Thank you very much. Good afternoon, everybody, and good morning for everyone in Sweden. My name is Vicka Oktaria. I'll be the moderator of this session. So as an overview, so in 2001, Master Program in Public Health, Master Program in Health Policy and Management and Health and Demographic Surveillance System, or HDSS Sleman, as a part of the Faculty of Medicine, Public Health and Nursing in Universitas of Gadjah Mada, in collaboration with the University of Gothenburg, established network and partnership to improve the capacity building for research and publications. And one of the agenda is the webinar series about the research capacity building. For today's session, we will have the research proposal, and we'll still have the upcoming sessions about data management and analysis, academic writing and presentation skill, and publications. So in today's seminar, we'll be discussed about the best practice of writing research proposal with light discussions on the research method, as well as constructing strong proposal utilizing the HDSS Sleman data. So I would welcome all the students from the Universitas of Gadjah Mada and from the Gothenburg University. I believe some of you are currently, some just started writing the thesis proposal. Maybe some of you are still struggling with the revision with your supervisor, and some may just start to planning what research to be do in the next coming semester. And in today's session, we will have two very special speaker for the first sessions. We will have Prof. Nawi from the Gothenburg University. He'll be delivering talk about the research proposal writing and research methodology using IMRAD guide. And for the second sessions, we will have Dr. Ifta Choiriyah, MSPH Ph.D. She will talk about development of a good research proposal using the HDSS data. So it is very important if you want to use the HDSS data as a part of your thesis. And each session will be around 40 minutes, and we will have the questions and answer sessions after the talk. And question will be, if you have any questions, you can just type in the chat box, or you're also welcome to raise your hand and turn on the mic if you want to speak directly to the speaker. And I think, let me share my slide. I will introduce the first speaker. Just a moment. Okay. All right, Professor Nawi, he is a professor of global health from the University of Gothenburg, Sweden. He also a guest professor of epidemiology and global health at Umeå University, Sweden. He has the medical degree from the University of Gajah Mada. He actually was my thesis supervisor during undergrad. I learned a lot from him. He also pursued the MPH and PhD from Umeå University. His research focus is about epidemiology of non-communicable diseases and aging, including disability and quality life among older people. He has a very extensive research and writing experience. He has published, I think, around 115 papers in peer-reviewed international journal, and some of them are very high reputable journal, which is Lancet, Bulletin of WHO. So without further ado, I would like to invite Prof. Nawi to deliver your talk.
Thank you very much, Vicka, for the kind introductions. I will give the talk if you still remember your research question when you did your study at Gajah Mada University.
Yes, I did the quit and win smoking cessations we are doing from the WHO program, I think.
It was just a joke, I mean, of course. But thank you very much. I think it has been a pleasure to be your supervisor back in 2004, 2005. As you mentioned, Quit and Win was a WHO program. We had the Quit and Win project in collaboration with the WHO back in 2004. And you, together with a few other students at the Faculty of Medicine in Gajah Mada, participate in this project and has been very helpful to the project. So I'd like to extend my thanks also to you and your colleagues for your help during that time. So, and good morning, good afternoon, everyone. Today I'm going to talk a bit about development of research proposal. Since we have, I guess, a mixed bag of students with more experienced students who probably have developed their proposals, and newbies who are going to write their research proposal maybe in months to come. So I'll try to make these presentations, try to cater the needs of everyone in 40 minutes. And I have up to 10 to 8 o'clock in Swedish time. Okay, so as Dr. Vicka mentioned, this will be the first series of a series of webinars that will be conducted between the University of Gajah Mada and University of Gothenburg in Sweden. So the idea is to build the research capacity of researchers at both universities. We aim to conduct the seminars of a few other webinars during this spring 2022. We'll see how these things progress. But for today, I'm going to talk about the research proposal development. And words of note is that today is not about grant proposal writing. So I'm directing this talk to students who are going to do their master thesis or undergraduate thesis or maybe doctoral thesis. It's not about grant proposal writing, because this will be another set of talk if we focus on grant proposal writing. But also a few slides about proposal writing, which will be slightly different compared to a proposal that you are going to write as a student. So if you submit a research proposal to funding bodies, what do they actually look for? How would you be able to successfully get a research funding from a research institute? So of course you need to write a good proposal and submit it to the research funders. And what constitutes a good proposal? So my definition of a good proposal, as you see, it's very lengthy. A project proposal is considered good and excellent if it has excellent scientific quality, and it's proposed by a highly credible group. I'm sorry for the mistake over here. Qualified applicants. So in addition to the scientific quality, the proposal needs to be proposed by qualified applicants. And I say applicants here because we propose research proposal not as single individual, but as a research group. And the proposal or the project should have high feasibility in its implementation in terms of the research environment and infrastructure. So it should be conducted in a well-established research environment and has sufficient infrastructure to conduct the research, as well as research team and their skills. It has feasible time plan and assessment of risks and gains, and is relevant to the program objectives. So we submit research proposal to specific calls. If the calls demand us to do something on COVID-19, then we cannot submit other proposal for sure. And the proposal should address compelling research question within its scientific area with apparent originality and novelty. These last two criteria are very important for grant proposal writing, originality and novelty. So it's a long text. I try to summarize this into a few keywords which I think are important. First, scientific quality. Second, good applicants. Third, the proposal should be feasible to be conducted within the certain time frame. And the research topic should be relevant to the program objective as well as original and novel. So in short, I would say an abbreviation, I use an acronym of SAFRON. I believe maybe everyone knows what SAFRON is. So a take-home message from this short talk would be, if you do a grant proposal writing, you should fulfill SAFRON, which is scientific quality, applicants, feasibility, relevant, originality, and novelty. And I put feasibility twice over here because I think feasibility is very important. Of course, a lot of us has very good research idea. We want to do a lot of things. But when you submit a research proposal, feasibility is one of the most important aspects that is being assessed by the reviewer. You could, of course, propose that you are going to reach the moon, but if you don't have sufficient budget, if you don't have the right people, and you don't have the time, then the proposal will be considered unfeasible. So I think most of these criteria could apply to master thesis proposal writing, undergraduate thesis proposal writing, doctoral thesis proposal writing, except maybe the applicants, because you will be the only one who will be assessed in terms of the applicants. And the consideration of originality and novelty probably is a bit less compared to grant proposal. So as Dr. Vicka mentions, I used to work at Gadjah Mada University as I started as a research assistant back in 1998. Maybe many of you have not been born yet. And then I progressed my careers and become a lecturer during the period of 1998 to 2007, after which I moved to Sweden and start working as guest lecturer at Umeå University. And since my first year as guest lecturer at Umeå University, I have started developing research proposal, mainly as co-applicants to some other senior staff member. And what you see on the screen is one of my very first research applications in Sweden. So this proposal focused on the development of risk assessment for diabetes. Predictive risk assessment for diabetes in Indonesia. It was submitted back in 2011. It was assessed by, of course, the Research Council, and the decision is that we did not get the funding. So my first attempt to get the research fund failed. You see the comments from the reviewer that the proposal was assessed as good. I was assessed as with some experience with NCD, and then I have a few colleagues with a lot of experience in Swedish and Indonesian settings in different disciplines, and we together were assessed as have vast experience in disease modeling. But the decision is we did not get the funding, and you can read the reason why we did not get the funding, because we did not target specific aims that they have in the proposal. So it was a disappointment, I think. So despite the fact that the application was graded as 4, and as you see, 4 is very good. In grant proposal writing, very good is insufficient. You have to be excellent to get the money. But I was not that disappointed with this first attempt to get funding, because at least they thought I was young. I was young by then. I think I was happy with that. So 10 years down the road, back in 2021, last year, we submit another proposal. So during this time, I've worked with a lot of different proposals and have been successful in different research applications to Swedish Research Council. And this is an example of one of the latest research funding that I have received last year. So we start the project this year, 2022 to 2024, sorry. So we focus on COVID-19. What we try to do is to understand the diversity in vulnerability to get COVID-19, to be hospitalized from COVID-19, to die from COVID-19, and actually to get vaccination for COVID-19. So we look at communities as well as public health institution capacity to respond to COVID-19 threats. And of course, COVID-19 will not be the last pandemic that we will see in our lifetime. We'll face more and more pandemic in years to come. And we were successful in this application. We were quite happy. And as you can read in the concluding remarks, I think our application was assessed very well, was appreciated very well. That says that the project is well planned, very comprehensive, with some advanced methods, and with relevance, highly relevant to the current societal situations. But what I think was appreciated well is the last sentence by the reviewer. It's difficult to find shortcoming in the research plan. So when you write research proposal, I think you need to write it perfectly. You need to be excellent to impress the reviewer, so you will increase your chance to get the funding. But that would be the last slide for today about research funding. So I'm not going to talk about research proposal today, but what I'm going to focus on is on thesis proposal writing. Of course, as you remember, the saffron acronyms, you probably do need to fulfill all the items in saffrons to be excellent, but you need to write a good proposal, and I think you need to have good ambition, because a good proposal will result in good research, and if you're lucky, good research will end up with good publications. So I supervise quite a lot of students. I don't remember the count now, but I supervise more than 30-40 students, I think, during my lifetime at Gajah Mada University. Many of those were master students at field epidemiology. I see that there are a lot of FETP students in this room also. So I had the honor to work with a lot of your senior back in 2000 to 2007. But I also supervise students from undergraduate program. On the screen here, example of two theses which I supervised during the period of 2004 and 2005. The first one focused on the cause of death in Purworejo HDSS Health Demographic Surveillance System in Purworejo District, which is a sister, a brother, I would say, a brother to the Sleman HDSS, which will be presented by Dr. Ifta in a while. So the second study focused on the exercise behavior among students at the Faculty of Medicine at Gajah Mada University. So the students, Veronica, used a trans-theoretical model to analyze student behavior in terms of physical activity. So the second thesis was actually published at the local university journal. Then when I moved to UMI University, I started supervising master student also, and the one to the left, for example, from Sabnam from Iran, she studied periodontitis and chronic kidney diseases. So that study was done back in 2010. I think we got the paper published back in 2015. And the last two theses I supervised here at the Sahlgrenska Academy at University of Gothenburg are the ones on the screens. So Sianga studied socioeconomic inequality and cognitive function using secondary data in South Africa. He did some mediation analysis, tried to identify mediators between inequality in socioeconomic factors and cognitive function. So that thesis has been written as a paper and has been submitted to one journal. It was rejected, of course. There's always good comments that we need to take into account, and he's revising the paper to be resubmitted to another journal. So the last thesis was written by Tang. She did a systematic review and meta-analysis of tobacco cessation among people living with HIV in low middle income countries. So systematic review and meta-analysis is of course one study design which is regarded as one of the best study design that one can do. But it is a very demanding thesis. It takes a lot of time to do systematic review, but it's not impossible to conduct a systematic review for a master thesis. So Tang is currently doing a PhD here at the University of Gothenburg together with me. So she will continue focusing on people living with HIV in low middle income country with specific focus in Vietnam. They are doing an interventions to provide smoking cessation intervention for people living with HIV. So the reason why I show all these different theses is to motivate you that it's possible to write a good thesis which will end up as a publication in peer-reviewed journal. And it's always good to set your ambition high. Write a good thesis, try to publish it as a good paper in strong peer-reviewed journal, and that could be probably your tickets to get a PhD for your next career opportunities. So currently I'm also supervising a few PhD students. I think I probably have around 11. See, I have to count how many students I have. So I have 11, and one of the most senior PhD students is actually in this room also, Ifta Choiriyah, who is the coordinator, research coordinator, I think your title, Nia, at the Sleman HDSS. So Nia is studying social supports for older people in the European countries. So she used the SARE data, which is publicly available data, and tried to understand the pattern of social supports for older people in the European countries. And she conducts study across different European countries. So she is currently, or she has published actually two papers in very high impact journal, I believe. And she is currently submitting her third paper and going to finalize the fourth paper very soon. And she hopefully will defend her thesis at the end of this year. So that's all about the thesis. So I'm currently working as the thesis coordinator for the Master of Global Health thesis at the University of Gothenburg. So many of the students have just started their thesis process. And this is what we give to the student when they enter the course. And we inform them about the structure of the course, but most important, we inform them about the final product, which is the thesis. As you see over here, I highlighted the structure of the covers, the thesis, which should include all of the following. So this is the final product that students need to submit at the end of the thesis course. For us, it will be a defense of the thesis, a public defense of the thesis at the end of May or the beginning of June. So students aim to write thesis and present the thesis at that period of time. And these are the things that they need to include in a thesis. I'm not going to go through this as I'm going to go through some of these in the next few slides. But we require students to prepare the study plan. We don't ask students to submit a research proposal. This might be different compared to students at Gajah Mada University who are required to submit a research proposal. But I'll inform you what we ask students to write in the research plan or study plan. So now two books I would like to suggest those who are going to do research, student, I believe. This book, I believe, is quite good and quite systematic. Research Method, the Basic by Nicholas Walliman. One of the graphs which I extract from the books shows the lengthy process of research. So we start with research problem at this on the top left over here. All research should start with a problem. We try to investigate a problem. We go through the books and study the theoretical background and understand what research methods as relevant to study the problem. And we write a proposal. So I'll talk a bit about what should be there in the proposal. And we need to apply for ethical permission to conduct the study if needed. Once we have the ethical permission, then we carry on the work. So as you see, it's a lengthy process until you get a report to be disseminated. So I believe some of us are still at the very first stage to identify problem. So another book which I would like to suggest you to read is the book by Ranjit Kumar. It's now on the 5th editions. I got to know this book back at the time when I was in Indonesia, when I taught research methodology for the master program in Indonesia. By then it was only the 2nd editions. Now it has been extended to the 5th edition. It becomes a very comprehensive book. I think it's a very good handbook that you need to have if you like to conduct a study at the undergraduate, master or master level. So in my presentation today, I will use a lot of materials from this book, and hopefully you will find the relevance if you read this book. So according to him, there are 8 steps to carry out research. First is, of course, to decide what you want to research. For that purpose, you need to formulate a research problem. Before you conduct your research, you need to plan for the study. And that involves conceptualizing the research design. I mean, what design are you going to use to answer the research problem, as well as designing an instrument to collect the data, and then decide on where you want to do the study site as well as the study population. And hence you need to collect sample. You need to draw a sample to conduct your study. And of course, the next step is to write a research proposal. After which you do your research by collecting the data. When you have the data, you process the data, display the data, analyze the data, and write a research report. For many students, a research report will be your final thesis. So, and he, in this book, illustrates this process in this diagram, which looks very nice. I think a bit complicated, but nice. So as you see at the middle part over here, you have all the 8 different steps to do the research. So the first step, of course, is to identify a problem. Okay. And we are going to go through this different step quickly in this short presentation. So I'll just continue with the problem. So imagine you land in the country, and this is in Jakarta, where University Gadjah Mada is located. I worked there during 1998 to 2007, and in 2003 we got a big project from the National Institute of Health to run smoking cessation program in Indonesia and in India. So the project was led by colleagues at the Minnesota University, University of Arizona, and University of Kansas City in Missouri at the United States, in collaboration, of course, with Gadjah Mada University. And one of the project aim is to develop smoking cessation as well as to understand why people don't quit. So imagine you come to Yogyakarta. I took this photo back in 2003. And this is what you encounter back in 2003. It's a very large billboard of tobacco advertisements. And the size of the bus that you see there, the blue bus, is the same size of the bus we see here in Gothenburg also. So you can imagine the size of the advertisement. And smoking was rampant, and I believe smoking is also rampant nowadays. And this is in front of the big mall at the center Yogyakarta in Malioboro. You can get cigarettes easily. And this is, as you walk on in the park, for example, this is one of the few which we encounter. And I believe it's the few that we will encounter also nowadays if we walk around the city. So now, based on this observation, I would like to get a more interaction with you. I have 2 questions only in this short presentation. So if you can go to menti.com and key in the codes 3403, I need to activate that menti.com, so give me a second. Okay, you should be able to see that already. I have activated the menti.com. My first question to you is, what problem do you see from these 3 pictures? So I would appreciate if you go there, key in the codes, and just type in the problem you see. Hope we'll have a lot of participation from over 170 participants today. It's anonymous, so don't worry that people will know who is answering what. So we will not get your name, just your statement. What problem do you see in these photos? Okay, so we give everyone like 1 minute to do that, as we don't have much time, so I can progress in a while. Okay, 34033067. I'll stop sharing for a while so I can see the responses. Great. Excellent. I have got a lot of responses now. I think over 20 now. It's a lot of good comments. Excellent. Very, very good. I'm happy with all the responses. So how could we identify research problem? We can identify research problems just by walking on the streets, by observing the community, by observing the population, by observing the phenomena. So research problem could be identified by studying people. Look at people, look at organization, look at groups, look at community. You could easily identify problems. So the subject area could include some problems. I think the way you describe the problems are very good. Some talk about association, some talk about the needs, some talk about the attitudes of the father who carry the girls while smoking. Some talk about a group of people, I think. But also you can talk about the program. I think in some of the comments I see that people talking about smoking tobacco control program also. And talk about phenomena. So we could identify problems from our surrounding, from what we see, as well as from what we read, for example. So now COVID-19, of course, is a serious problem for many of us. As WHO mentions, COVID-19 pandemic will not end until everyone get the vaccinations, or most of the population get the vaccination. And on the screen here, you see the inequality in vaccination coverage. So the map to the left shows the inequality. In some countries, we see quite dark color. The dark color represents area or countries which have been able to secure a lot of vaccines, and they have received a lot of vaccines. So Sweden, for example, we managed to secure a lot of vaccines, and booster vaccine has been given to many of the population. I've got my booster almost a few weeks ago. For example, I believe in Indonesia also, the country have managed to secure quite a lot of vaccine, but I understand the distribution of vaccine is still a problem. But we have a serious problem here. I'm talking about problem. That's the focus of today. Only 62% of the world population have been vaccinated with COVID-19 vaccine, at least one dose. But there's a big discrepancy between what people in high-income country have received and what people in low-income country have received to date. As you see on the graph, on the map also here, Africa is quite light in color. And that represents that the fact that only 12% of the African population have received their first dose of vaccination, as compared to almost 70% of people in high-income countries like in Sweden, America, Canada, Australia, for example. So there's an inequality in terms of the doses of vaccine that has been received by the populations, and this could potentially generate inequality or deepen the inequality that we have observed in the population. So is this a problem? Of course, this is certainly a problem that we have to face with respect to COVID-19. So as you see over here, we can identify research problem by simply walking on the street, observing the phenomenon, see how people behave, and also by reading some websites, some publications, and so on. So try to identify research problems. So when you see a problem or when you know a problem already, of course, the first step is to try to understand the problem by reading more on the problem. So you need to review the literatures, try to improve our understanding and knowledge on the field. For example, if you are interested to study smoking in Indonesia, you probably want to Google or to look into PubMed, what have been done in Indonesia, what kind of research have been conducted in Indonesia. If you are interested to study vaccination for COVID-19, you can read published materials. There are tons of papers now being published in the last 2-3 years on COVID-19. Try to see what other people have studied and what have been studied in Indonesia or in Sweden, for example, or in your home countries. So first is to look at what have been published to improve our understanding on the problem as well as on the scientific research field. And that will help us to clarify and focus on a specific problem. At the same time, will help us to improve our methodological skills. So there are 4 steps according to Ranjit Kumar in his book. First, of course, is to look at what exists. Second is to review the selected researchers, try to see what finding people have reported. And third, most important part at this step is to understand the theory behind the phenomenon. So you try to develop your theoretical framework. Read the books and see why people don't want to accept vaccines. The keywords vaccine hesitancy, what drives people to be hesitant for COVID-19 vaccinations, whether people have enough or sufficient health literacies to understand the importance of vaccine, for example. So health literacy could be a theory that you want to focus on. In terms of smoking, for example, why the father smoke while having the daughter on his hands, for example, whether he is not literate enough about the health impact of cigarette, for example. So health literacy could be used also. You might think maybe the father will quit smoking because he has a young daughter. So then you probably try to search for theories that could be used to understand why people quit smoking. For example, health belief model theory. Why people quit smoking? Maybe people assess the benefit and the risk. So you need to understand people risk assessment. Maybe if people perceive more risk than benefit of smoking, then they might quit. So the third step over here is to try to read different theories that you could use to understand the problem. And the next step, or the final step in this step 1A, is to develop the conceptual framework. So from the theoretical framework, you try to synthesize what could you use as the conceptual framework. So the theoretical framework, you can view the problem from different theories or perspective, try to understand the pro and cons of the different theories, try to understand the knowledge gap. And then later on develop a conceptual framework. Conceptual framework is a part of theoretical framework on which a research is based. So it's possible you combine 2 or 3 different theories and develop your own conceptual framework that you are going to use in a research. So that's the first step. The second step, of course, when you know the problem already, you try to formulate a question. So how do we formulate a research question? You need to think of whether you have sufficient fund to conduct the research, the time available, knowledge of relevant disciplines, and whether you have sufficient skill to conduct that research. So there are different things that you also need to consider when you define a problem, the interest, the magnitudes, whether you have, whether it's possible to measure the concept. For example, vaccine hesitancy. How do we measure vaccine hesitancy? There are tools to do that. What kind of tools is available? If you need to design your own tools, if so, how are you going to do that, and so on. The relevance of the problems also dictates the research problem that you want to answer, availability of data, and ethical issue. So on availability of data, I think this is of most importance. Whether it's possible for you to conduct your master thesis or undergraduate thesis within the available time. Many of us don't have sufficient time to do lengthy research. Most of us probably have only half a semester to collect the data, or maybe 1 semester to collect the data, or maybe even 2 months for some of us. So you need to be realistic on what you can do during that limited time periods. And hence the consideration of secondary data is important. Secondary data means that data which is already available, which is ready for you to use. And that is what I think Dr. Ifta will talk about in the second presentation. So I think I'll skip this Menti again. So an illustration of a research problem, for example, you would like to study about alcoholism. There are a lot of things in the second step, as you see, that you can study about alcoholism. And these are the problems that I think you have put in on the menti.coms. So it's a lot of things, but then you need to pick an area which is of your interest. Of many interesting topic, which one do you want to focus on in this specific time? And then raise a research questions. A research problem should be phrased as a research questions. And on step 4, you see some example of research question. What impact does alcoholism have on marital relations? So a research questions should be posed in such way that you can see the exposure and the outcome. In this case, in this example, alcoholism is the exposure, marital relationship is the outcome. So you should try to phrase the research question in such way. How does it affect various aspects of children's lives, for example? And it's referred to alcoholism. So alcoholism again is the exposure and children's lives as the outcome. And the effect on family finances, for example. So once you have your research question, then you formulate your research objective. What are the objectives of this research? Of course, to answer the research question. Some people think that a research question and research objective overlaps because the way you phrase it is probably quite similar because they are phrased quite similar, but not necessarily. I think you could phrase the research objective in a way that is more concrete. Okay. So the research objective leads to hypothesis. So when you have the objective already, in some research you need to develop hypothesis. So what are the criteria of good hypothesis? Hypothesis should be simple, specific, and conceptually clear. Okay, so a simple hypothesis is better than a complicated hypothesis. It should be possible to verify the hypothesis, which means that we should be able to measure the variables specified in the hypothesis. For example, in the previous example, here we have one of the research objectives is to ascertain the impact of alcoholism on marital status. So maybe the hypothesis could say alcoholism will lead to broken relationship in marital relations. Okay, broken marital relationships. So then you need to be able to measure alcoholism. How do we measure alcoholism? How do we measure marital relationship? And that is what I meant by capable of verification. So you should be able to measure the variables in order to verify the hypothesis. Okay. Then once you have a hypothesis, you need to select a design. A design is dependent on the hypothesis. So you can't really decide on the design until you have the objective and the hypothesis. So either you are going to do a quantitative study, you are going to run a survey, collect data, and then analyze the data quantitatively, or either you are going to do a qualitative survey. What I mean by qualitative survey here is, for example, you go out and talk to people, you interview people, or you collect people in the same room and do a focus group discussion. You discuss with people. Or you can choose to do a mixed method design by combining both quantitative and qualitative design. So what should you consider when you select a design? Of course, the hypothesis and objective are very important to be considered. But other things that could be considered, for example, whether you can get valid data based on specific design. For example, if you are going to do cross-sectional study, I hope people know what cross-sectional study is. You want to measure exposure and outcome at one time point. Is it possible to get a valid exposure if you do a cross-sectional study? If you ask people, for example, to remember how many cigarettes did you smoke 2 days ago, maybe people could remember that easily. But if you ask the question, how many cigarettes did you smoke 2 years ago, it's very impossible to get a valid data. Okay, so that will yeah, that will somehow influence the design that you are going to study. I might have 5 minutes left, isn't it so?
Yeah.
So I'll try to conclude in 5 minutes. So the design should be reasonable and manageable also. You cannot propose, for example, a cohort study if you only have 2 months to do the study. A cohort study will necessitate follow-up of people over a long time. And then you look at the strength and the weaknesses. There are a lot of discussion about the strength and weaknesses of different study design that one needs to consider. So just a quick overlook on the different type of study design. If you meet the respondent only once, then we call it cross-sectional study. If we meet the respondent twice, maybe it's called before and after studies. If you meet the respondent 3 or more times, then we call it as longitudinal studies. So the more time you meet the respondent, the more resources and time you need to conclude the study. So it depends on how you measure the information. It could be prospective, it could be retrospective, or it could be a combination. A retrospective means that you require people to recall the exposure in the past time, or you could do experiments or non-experimental study. Okay, so those are the different study design. And then you need to design the data collection instrument. How are you going to collect your data? The tools like the interview schedule, the observation notes or questionnaire. Or if you decide to use a secondary data, still you need to look into the data for the right variables that exist in the data, as well as the right definition of the variable. And when you have decided the instrument and the design, you need to select the sample. Whom are you going to study? And there are a few issues here. You need to select the relevant people, and you need to select the relevant size of people. So hence the term sample size. And there are different ways to identify the study sample. Some is referred to as probability sample if you randomly selected people in the population, or if you simply take convenience sampling. If you take the first person you meet in the hall in the hallway, that's what we refer to as non-probability sampling. So I don't think I have time to go into this detail, but these are the things that one needs to consider. Either you do probability sampling or non-probability sampling. And those are all the things that you need to write in your research proposal. Okay, all the step 1 to step 4 are the things that you need to detail in your research proposal. So why do we need to write a research proposal? It's for yourself to try to consolidate your thinking about the research and try to make it more systematic stepwise. And it's for the supervisor or for your mentor to see if you are on the right track or not. So what should be there in a research proposal? At least these few things. It should consist of an introduction and a brief literature review to show that you understand the fields or the area of study. It should consist of theoretical and conceptual framework to show that you review the literatures already and you understand the different theories being used in this research area. And you should also include a statement of the objective or research question here. So either objective or research question. If we think that the two are quite alike, and you propose a list of hypotheses if relevant. In qualitative study, probably you will not propose a hypothesis. Okay, so those first 4 points are the important parts that constitute the introduction of the proposal. Then you move on to the method section where you start thinking about what design of study that I'm going to use, where I'm going to conduct this study, the setting, what instrument I'm going to use, whom I'm going to study, and well as calculate the sample size. How many am I going to study? And how am I going to collect the data? Okay, who are going to help me with the data collection and so on. When we have the data already, how the data will be processed. And think about the ethical issue and how they are going to be addressed. And finally, I think it's important to propose the relevant time plan and budget for the study. Maybe for a master thesis study or undergraduate thesis study, budget is probably not that important, but still I think, yeah, maybe it's still important because you need to consider whether you have sufficient budget or not. So that is common practice. So what we have here at the Gothenburg University, my two last slides, we don't ask for a proposal, but we ask students to submit a study plan, which consists of a title, background, and problem definition. These are exact what we ask students to describe. The aim and the research question, so quite similar to what I presented earlier. So we ask students to identify the backgrounds and define the problem and come up with research question. And we ask students also to define the methods and the materials and consider the ethics of the study and think of the expected results, or what would you expect from this study, and think of the timeline of course, disposition of the study. I think that's the last slide that I would like to present. So in 40 minutes, hopefully it gives you some idea about how to develop a research proposal, which is an important step for you to prepare and start your thesis, either at master level or undergraduate level. So that's all for now, and thanks for your attention. I hand it back over to Dr. Vicka.
Thank you very much, Prof. Nawi. Yeah, clearly there is a difference between writing proposal for grant purpose and academic purpose, but we agree that several abbreviation is a good way to navigate us how to construct it, with feasibility as the most important part that has to be, remembered by the students, how to make sure that the study will be feasible within their time frames. And let's go for the second sessions. Let me share the slide. We will hold the presentations until the question and answer until the last sessions. So we will have Dr. Ifta Choiriyah, MSPH Ph.D. She is the head of the Sleman HDSS. She's also the head of the Biostatistic, Epidemiology, and Population Health Department. She has completed her the medical degree from University of Gothenburg and also has completed the MSPH and PhD degree from the Johns Hopkins Bloomberg School of Public Health. And her research focus is in the development and transitions of adolescents through a life course perspective and determining of the health and well-being at personal, family, community, and environment and at the national levels. And she has published many papers in reproductive health. So welcome, Dr. Ifta. Time is yours. Thank you.
Thank you, Dr. Vicka, for your introduction, and also thank you and welcome for Dr. Nawi. Actually, I don't feel very confident to be in the same session as a resource person with Dr. Nawi because he's very senior researcher and I just graduated. So maybe I will just ask permission to talk in the next 40 minutes. So we want to, so in this session, I will provide practical topics of our practical consideration and tips for you if you are considering to use HDSS Sleman dataset, which I started to coordinate the data collection and the day-to-day management in the last years. So let me share my screen. So also if you have any additional questions about HDSS Sleman, you can check their website, and also you can reach out to me via email in this screen. So HDSS Sleman was developed and initiated by Faculty of Medicine, Public Health and Nursing in 2014, and it's been in its 7th cycle this year in 2022. So I will not dwell in very detailed manner in this session because we have limited time, but you can certainly navigate the HDSS website to know more detailed information about aspects of data collection and data analysis. So you're welcome to explore that. But essentially the HDSS Sleman is longitudinally monitoring demographic and characteristic of the population in a geographically well-defined area, which is Sleman Regency in Jakarta, Indonesia. So this is a very specific, well-defined population. And the main content of HDSS Sleman data, key data that we collected are the HDSS population register, where we list all the household member of HDSS household that you can use or other researcher use to base as a sampling frame for other studies, which usually is, if it's not a more specific topic of research or smaller quantitative of qualitative data. Also, you can use the HDSS key data of demographic events. And this is a very variable data from HDSS Sleman, because currently we don't have, well, it's still undergoing, you know, exploration and development of the comprehensive and integrated civil registration and vital statistics system. So it's not yet available. So HDSS data can complement the gap in those CRVS system if you are very interested in exploring the key demographic event, which is birth, death, migration, marriage, and divorce. So the HDSS data, while it's a very rich and complicated data, it has several limitations and potential that you can maybe appreciate or consider when you thinking about using or exploring HDSS data for your research or thesis project in the future. So HDSS, we have more than 4,000 household samples, and including around like 20,000 individual as its household member. So this is a very resource intensive data collection activities. And because we are currently being funded solely by Faculty of Medicine, we have limited resources, and we only have limited variables collected, especially at individual level. And also because this is in a geographically well-defined population, this is not representative of Indonesian population. So this is a highly contextualized, homogeneous population, which may not possible to provide generalization to the national Indonesia population. And we are currently only be able to collect annually, so once a year, which is maybe not short enough, not frequent enough to monitor certain demographic events that occur more frequently, for example, like in and out migration, or maybe early pregnancy outcome, such as like maybe like miscarriage or premature death, premature baby death. But there are also the potential of HDSS data development, because we are registering and updating their demographic profile and their relationship between individual in the household, etc. So you can actually explore the linkage of individual and basic or key demographic events through time from 2014 and 2022 longitudinally. And also a very valuable data is the cause of death data from verbal autopsy that we collected for all the deaths that are found or that are registered between the survey cycle. So while the homogeneous context or very specific context of HDSS Sleman is also a limitation, but it's also actually a potential, because due to the, like the homogeneous characteristic of the population, we can rule out heterogeneity of a lot of characteristics that affect someone's health, for example. So we can use HDSS population to test intervention, health intervention policy program in real settings. And another maybe development or benefit of HDSS data is in the era of big data, or like, multiple source of data, is that HDSS data can be used to complement, triangulate, or calibrate other data, such as big data, who lacks maybe several detailed characteristics that are not collected by big data, can be calibrated by HDSS data. So this is the limitation and potential of Sleman HDSS data that you can consider so maybe you can compare with your research plan or research objective to see if it fits your needs. For example, like if you need a nationally representative data, then maybe HDSS is not appropriate for your study. So you may consider other nationally representative data, such as SDKI or HD and demographic survey, or maybe Indonesia Family Life Survey, or Basic Health Service Survey, or Riskesdas, or maybe Susenas, or maybe Census. And this is also, you need to, so to be able to maybe explore and to inform you to decide whether your data, HDSS data, is appropriate or can fulfill your research objective, would be user should do some of the, like preliminary work and homework, so that they can consider like the pro and cons of the HDSS data. So one of the steps is to understand the setup of the HDSS site, and then organization, and then also like protocol, etc. of HDSS Sleman. So we actually have the website, but also for comprehensive or like one-stop information, for example, of the demographic, the profile of HDSS Sleman, you can check out this article that was published like 4 years ago. And we need to update it obviously, but then here you can evaluate the aspects or components of HDSS Sleman. For example, like you can evaluate the sampling design of HDSS. I can show you the article here. Yeah, I think it is. So this is the article actually. And this is the section about sampling design, and then also about the response rate. So you can evaluate whether the sampling design is appropriate for the study and whether it adequately represents the population that it targeted. So for example, this is like the sample size was calculated using this specific parameter. This is maybe like for you who are beginner, it's maybe complicated, but you will learn about it in epidemiology on biostatistics course, where you can use these specific parameters. Maybe you can borrow from other study if you don't have the data to determine the sample size and the sampling procedure. And also you can evaluate the response rate of the survey because if you have low response rate, then there will be bias introduced due to the low response rate, maybe selection bias, etc. So we can see it's typical to developing countries like Indonesia that we have high response rate for surveys, usually above 90%, but then you see in 2020, there is a little bit challenges because this is during the start of the pandemic that they have to do it using phone data collection, and it's very difficult to reach out and ask people to respond to the online data collection or phone data collection. So we have a very low, almost only like a third who respond to our survey. And we continue to be able to do face-to-face interview this year, so the response rate is back up again. And also you can appreciate or evaluate the survey instrument development or adoption. There are instruments who are already standardized and used in several settings. And you can see whether HDSS Sleman use maybe like the questionnaires that you think is the best or is standardized to evaluate or measure certain indicators or variable, or whether the process, if it's a new questionnaire, you can ask or find information how the process of adoption to see whether it's being considered like adequately, carefully for Indonesian context, etc. And also you can evaluate the protocol of data collection, whether the interviewer are trained properly, whether how the instrument are developed and how the instrument are administered, or if you have sensitive question, whether it's administered as a self-interview or it's being interviewed by interviewer, and the quality control steps that needs to be done to ensure the high quality of data. You can find it in the profile of the HDSS Sleman from the article that I shared, but also you can ask further by contacting directly the HDSS website and email. So you also have to do the work on understanding what data are available in HDSS Sleman and the general structure of the data. So like the theme of the module that are being collected, and maybe at what level and what are the sample of this module, and then also like the general structure of the data, because HDSS data and also like system data collection is very complex. So you actually have to maybe sit side by side with a data manager, HDSS data manager, to understand the structure of the data. But we provide resources for you to browse independently in the website. So you can look for the data catalog and the questionnaire or codebook of HDSS, for example. Yeah, you see if you can, I will share this. So this is the website. You can choose English or Indonesia, and then you can actually choose the theme, some of the theme of the HDSS module, and whether the wave 1 to wave 5. So wave 6 is ongoing. Also, you can see the code book. So this is the questionnaire of HDSS. So you can know what are the questions being asked to what respondent, what are the response option, in which wave they are being collected. So you know, like, oh, maybe if you need the temporal association between variable, you can figure out by using this code book and metadata. So they have this step-by-step screenshot about how to use the code book of the English or the Indonesian version, I guess. So these are the themes or module, like the big themes or module that are collected by HDSS Sleman. So for the background and much of the information, detailed information is actually collected at household level. So we have the household structure, meaning like the composition of the household member and then relationship between those, and then also like the demographic profile, like the religion, age, education, employment, etc. And then demographic events collected, so birth, death, migration, divorce, marriage, and then also a wealth index from the household asset ownership at the first cycle, and then it's repeatedly collected in, I think it's four or third cycle, I forgot. Then also, of course, this 5 or 4 big theme, that is reproductive and child health, and then infectious diseases and non-communicable diseases or chronic diseases, and then access to health insurance and healthcare utilization. And these are collected at household level. So there are household questionnaire asked to the informant respondent at household level, asking the household level data, but then also some of the non-communicable diseases module have been asked to individual sample. So we sampled an individual aged 25 years or older in each household to complete the individual questionnaire. And the themes are about non-communicable disease, health status and quality of life, and health behavior. So just to be aware, like this 5 or 6 big theme of HDSS. And this is like the detailed theme of household level data and individual level data. You can look at the data code book or the data catalog in the website also, but then see, you can appreciate actually there are although complex, but it's also rather maybe superficial data. So sometimes you may need to cite a lot of research based on HDSS, actually a development or maybe nested research from sampling frame of HDSS rather than using the data available. But there are also, of course, a lot of students at undergraduate and graduate level using the available HDSS data to complete their thesis project. So you can see that there are several standardized forms that have been adopted by HDSS to be administered to HDSS population. So you can see, okay, maybe like, okay, I want to use this variable or indicator or theme, and then I think I can appreciate that they use a standardized instrument to this, or maybe I don't want to do this section because they don't use standardized questionnaire and I'm not sure about the quality of data. That's fine too. So that's why like you have to evaluate and understand the instrument and then the protocol of administration, etc. And of course, also like the maybe underutilized, but also very important contribution of HDSS is the verbal autopsy module to determine cause-specific mortality, where in Indonesia, maybe a lot of death, still a high proportion of death is not, did not happen at health facility, and then people don't have actually a doctor appointed, cause of death, official cause of death in the death documentation or certificate. So this is a very favorable contribution of HDSS data. So what are like some of the ideas that you can further explore using HDSS data, Sleman, particularly Sleman HDSS data? So maybe I also reflect from Dr. Nawi session before. So you can actually start by considering the situation and context of the population itself. So for example, like HDSS Sleman is rather unique if you compare it with other HDSS system in developing countries, because most of the HDSS system is in maybe like rural or marginalized population, but HDSS Sleman is in highly urbanized area with demographic and epidemiological transition well underway. So this giving like a different unique context of the population. So if you consider that, then maybe like, okay, so there are several health problems that are relevant or high priority or high importance that can that you can consider to improve or to improve the significance or strength of your reasoning while you doing this research, for example. So if you see the population parameter of the HDSS population in 2019, I use the 2019 because 2020 we have a very low response rate. So you can see here it's aging population underway. We have very high proportion of population age 40 plus. Actually, it's almost 50% of HDSS population is age 40 plus, and almost 20% age 60 plus. So if you have this dominant population of aging population, then you can maybe expect or suspect that the primary health concern or condition of importance is non-communicable disease and maybe mental health condition, or maybe premature death due to chronic diseases. And then you can see also based on verbal autopsy is actually also consistent, the finding with the population structure of HDSS Sleman. We have leading causes of mortality during the 5 cycle of data collection. So this is the aggregate for 5 years. But if you are interested to see the breakdown by year or by age or by sex, you can ask the HDSS team for the breakdown. But then you can see we have the 3 leading cause of the mortality, cause-specific mortality is related to non-communicable disease or circulatory system is including stroke, and heart condition, and the respiratory system, and neoplasma malignancy. And this is when we present this data to other college in the School of Medicine. Actually, they are very interested also because it's consistent with the hospital data, but also some of it are maybe revelatory and surprising, because neoplasm is actually very high, 13% of cause-specific mortality. Although they see in the hospital is not too high in Yogyakarta. And then from verbal autopsy, there are several studies that have been conducted using secondary data from HDSS, mainly by Dr. Beta Alam Gizela from the forensic department. But there are still a lot of issues that you can explore using verbal autopsy data. So for example, like the cause-specific mortality pattern by these various characteristics, mainly the household or socioeconomic or demographic factors that we collected at household level. You can explore that. And also considering the context of Sleman as a highly urbanized region with demographic and epidemiological transition, we can maybe explore rare death in this specific context. For example, like maternal death, when you consider or maybe understand or remember the national level data, like the primary cause of maternal death in Indonesia is bleeding. But then actually in Yogyakarta, a lot of maternal death is associated with chronic or non-communicable diseases, including heart conditions. So maybe because we can catch rare death using this verbal autopsy. I have to check with the data manager whether there is actually maternal death. But then if you consider it, you can like do a topic about this type of death in this specific context. And also there are some development of verbal autopsy data. So there are adoption of health service utilization and background and context of death that you can use to examine whether there are factors related to social condition and health system that contribute to the death of the person. It hasn't been analyzed, so you can see that. And most recently, the adoption to include additional question to identify COVID-related death. So we can identify COVID-related death and maybe factor associated with the death. And also, it's also important related to the big data or maybe integrated CRVS system. Verbal autopsy can be used to triangulate the comprehensiveness or the coverage of CRVS system, or also maybe we can use it to try some pilot project to integrate it with CRVS system or information. Lastly, probably this is my last slide, is the high prevalence of non-communicable disease. It's very related to the demographic and socioeconomic context of HDSS Sleman population, which is aging population consistently. we see also high prevalence of hypertension, and this is self-reported NCD diagnosis. So maybe the number is higher because not a lot of people actually when maybe screening for hypertension, for example. And then also high prevalence of probable mental health disorder in 2019. And based on the low response of 2020 survey during COVID pandemic, is actually also we see the increase in probable mental health disorder prevalence from 18% in 2019 to be about, I think, I forgot, it's 20 something in 2020. But also you have to consider the low response rate in 2020. And also you can maybe explore the association of this health outcome or NCDs with those background or characteristics we collected at household, at individual level, but you have to also like consider the timing of the data collection. That's why you have to understand the general structure and the timing of each module. And then we also have the utilization of healthcare data and then access to health insurance. But then the problem is more of the maybe underutilization of healthcare because Jakarta is very advanced in their health profile. So we actually for other health theme, so we actually have high insurance coverage. JKN is more than 80% are actually insured, and then also high performance in maternal or reproductive health and child health, so immunization status, and then skilled birth attendance is very high. So maybe it's not a problem of concern in this population, but the other thing is actually maybe specific problem to urban population. For example, like skilled birth attendance is not a problem in Yogyakarta because 99% of Yogyakarta, Sleman mother actually deliver in health facility with skilled birth attendant. But the other problem that is emerging is the high and like increasing proportion. So like in each year there is an increasing trends, consistent trends of increasing proportion of cesarean sections. You can explore that and maybe develop new nested or smaller study or qualitative study or maybe smaller quantitative study to explore that based on those unique findings of Sleman. Yeah, I think that's it all from me. Thank you so much for your attention and time. Thank you.
Thank you very much, Dr. Ifta, for the discussions. We have now heard about the potential as well as limitations of the HDSS data. And back to the sub-roman acronyms about feasibility, I think this is a great opportunity for master students to take secondary data analysis from HDSS, given the large population covered as well as a very rich data. And now we're going to the Q&A sessions. We have 20 minutes for this. You may ask the questions directly by raise your hands and maybe speak directly to the speaker, or you may also type the questions in the chat box. So yes, anyone who have the questions, just please. Maybe I'll start with the questions. It is for writing a proposal. I know that all students have a brilliant idea, but sometimes how to put it in a writing, it's quite challenging. And do any of you have tips how to, translate the idea into concise and well-structured writing?
Dr. Ifta, do you want to have a go?
You first.
Okay, I think good question, Dr. Vicka. To me, I think the most important is just to start, because don't aim for precision, perfectness, because I think the most valuable exercise is to just start with the imperfectness, and then you continue revise and revise and revise and revise the proposal again until you are happy with the last draft before submission. When I did my PhD study, one of my PhD supervisors said to me, I will never approve your paper draft until I see the 10th version of the paper. So you will never get the best draft at the first attempt. I mean, that's for sure. When we write research application, we always count for sufficient time to read, revise, and do the same multiple times before the last date of submission. So I think it's very difficult for we to get a good draft, but if we don't start and try, we never get a good draft. I think that was, I would say.
Do you have anything to add on?
Yeah, so I don't have like a very extensive experience about it, but I want to reflect on the frustration during my PhD dissertation probably. So my supervisor actually demand me that, okay, so if you want to know if you have a clear problem or clear statement, problem or research question statement, you can actually try to do it by constructing your hypothesis. So if you can, clearly state your hypothesis with the clear like direction and then the population and then the timing, etc. Maybe you are near with the clear research question. The other thing also is it's very also rigorous process for me, because then I have to read a lot of papers just to be able to reflect or write one sentence. So that's why also, like, I think I agree with Prof. Nawi that you just have to read and reflect and then revise, and then maybe don't hesitate or don't be afraid to come to your supervisor more often, because I knew, like, I did it myself, so I ran away from my supervisor for several time, and then it actually hindered my progress, because I was afraid that I don't have anything valuable to offer to him, but he is actually very, very welcoming for me to come with half-baked idea or research, and then it will help me to identify gap or unclarity in my research questions.
Yeah, that's the same experience with me as well. And what my supervisor also suggested is to have your peer to review your proposal before you send it to someone else, especially your supervisor. So you can have someone to also talk and try to make sure that your idea is clear and understandable. So we have a questions here from Maulana. It's about whether the data collected by HDSS is always synchronized with the data collected by the surveillance at the Sleman Health Office. Is there any difference with the data, especially during the pandemic? I think I made questions for Dr. Ifta, I think.
Yeah. Unfortunately, we haven't synchronized our HDSS data with other Sleman data set, but from maybe we can appreciate or evaluate the data from HDSS compared to Sleman HDSS, Sleman data. We can look at the population structure generated by maybe demographic profile of Sleman with HDSS Sleman data. So the difference between our data and the official data from Sleman is actually because of the sampling. of our HDSS population. So because we don't include the household who are identified, or maybe they expect not to be there in the next 6 months or permanent household, we exclude those households. So because you know, like Sleman is urbanized area and it's maybe destination for temporary residents, so we actually don't include a lot of those temporary residents. Maybe explain the difference between the population of HDSS and the population structure generated by official Sleman data. We will see because Sleman also, I don't know, I haven't checked the latest health profile of Sleman, but for the pandemic data, data collection during the pandemic, we actually reduce the burden of the module to be collected, considering the health risk, and we don't want to expose our enumerator to this risk, so we actually have to cut several modules, but we include the important data regarding COVID, so socioeconomic effect of pandemic, and then also health care access and utilization, and then mental health, and the other one I forgot. I think that's all. Yeah.
Thank you, Dr. Ifta.
Yeah. Compare.
If I may, Dr. Vicka, if I may add to this response also.
Yeah, sure.
Yeah, I think I would like to start by thanking Dr. Ifta for her leadership at the Sleman HDSS. I think it's a very impressive infrastructure. And of course, Sleman HDSS is led by, or is coordinated by, the Faculty of Medicine at the Gadjah Mada University, which is, of course, is a research-based institute, research-based activities, which is very different compared to the program surveillance done by the Sleman government. A question by Mr. Maulana, I think, Pak Maulana. The district government, of course, they have their surveillance systems, but usually surveillance at the district governments, Sleman district governments or other district governments, are based on programs and disease specifics. So you have a surveillance for tuberculosis, surveillance for malaria, dengue fever, and so on. But in Sleman HDSS, it's a research-based institute which conduct surveillance of the population. So I think they have different purposes. But I think it's a very important idea to try to feed back the information to each other. And for that, I think I would like to congratulate the Sleman HDSS for the extensive efforts that they have made to make use of the data and provide feedback to the Sleman government for policy making. I have not seen many HDSS in the world which have done structural, systematic feedback system. I know that I think Dr. Ifta is too humble, I think, but Sleman HDSS is certainly an extensive resource demand infrastructure. So for that, I think I applaud for the leadership of Dr. Ifta. There's a lot of work to be done, of course, to improve the quality of the surveillance, but what have been done so far, I think, should be applauded. And I would like also to add, I think, to add my personal opinion about Sleman HDSS. It's a very extensive infrastructure, as I said, and it's the only one in Indonesia. You don't find other HDSS in Indonesia, a country of 260 million people. Despite the fact that Sleman HDSS only study 10,000, 20,000 people, but it's the only infrastructure in Indonesia which collect repeated longitudinal data. As we have seen from Dr. Ifta's presentation, the Sleman HDSS started in 2015, and until today it has gone into the 7th wave of data collection. We find nowhere in Indonesia such infrastructure where we can follow the same household and the same people 7 times. Yeah, Dr. Ifta referred to Indonesian Family Life Survey, or IFLS, which started in 1993. But of course, that is a national level study, follow the same people over time. But they have very infrequent follow-up. I mean, the first study was in 1993, then it was before the economic crisis in 1997, and I believe the next one was in 2001, 2007, and 2013. Imagine, even though the data is at national level, but if you have like a 5 years gap in between follow-up, so many things could happen in 5 years. And that is, I think, the value of the Sleman HDSS. They follow people every year. I know Dr. Ifta says that it's probably not possible to study some phenomenon which is of acute nature. For example, it's probably not a best design to study acute diarrhea, because acute diarrhea happens in very short time, and when you come, you don't see a lot of acute diarrhea people. But still, it's an infrastructure with a lot of investment and of good values for everyone. For me, as a collaborator, for student at Gadjah Mada University, as where this infrastructure is being hosted, and now we are talking about collaboration with University of Gothenburg. So we certainly want to develop this collaboration so students from Gothenburg, be there at undergraduate level, master level, or doctoral level, can do study visits or attachment to the Sleman HDSS, of course, under the leadership of Dr. Ifta, and can learn the data that has been collected. So I also want to say, finally, on this infrastructure is one of the infrastructure with very high response rate. And we know response rate means that how many people could we follow up the next time we come. I don't see many infrastructure in the world which have response rate over 90% over 7 waves of data collections. As Dr. Ifta showed in a very nice table, the response rate, or the ability to follow up to 90% over time for 7 years, I don't see that a lot in many infrastructure. So we conducted survey in Sweden. So we paid a lot to Statistics Sweden to distribute survey questionnaire, and the response rate we got was only up to 40%. So if we want to compare the data quality, Dr. Ifta, I would say the data quality I have here in Sweden is less than what you have in Indonesia. So for that, I think I admire the leaderships. I extend the admiration also to Dr. Fatwa, who led the development of the HDSS in the beginning. So very good infrastructure, I think, which is a good asset for the students. And at the University of Gothenburg, we have talked about collaboration, and of course this workshop is the beginning of the long-term collaboration. We focus on research proposal today, and hopefully in the next and upcoming workshop we can focus on data management. Assume that we have the data already, how to handle the data. Many students, I believe, they are at very early stage of their research career. They are a bit confused probably. When I have collected my data, what should I do with my data before I start analyzing the data? So I could envision, for example, a second session on data management and a third session on data analysis, a different strategy for data analysis. I could also envision probably one second last session to be thesis writing. I mean, how you write the results of the analysis in a good way. And finally, maybe how to convert a thesis to publications. Many of my students whom I supervise at undergraduate and master level, they have converted their master thesis to peer-reviewed publications. So I think we should aim high and stimulate the students to invest a bit more time beyond the thesis time to move forward the good results and end up with the good publications. I think it's, I would say it's a triple win solution. It's win-win-win solution for the student. It's good for the CV, for the upcoming and future endowment. It's good for the infrastructure, Sleman HDSS, that the data is being used and being published. And that's an ethical way to use the data. I think it will be unethical if we have collected so many data and left it unused. And finally, I think it's good for the university. So I would say I would motivate all students who are in the session today, aim high, come with a good research question, good research proposal, and aim high to publish the research results. So I'll stop there, sorry.
Thank you very much, Prof. Nawi. Yeah, I agree that we must applaud Dr. Ifta and team from all the hard work that have been put to maintain the HDS running for these quite long years. We have a few more questions from Valentina Lasmis. He was asking about how to, when deciding a research topic, sometimes students are confused whether the problem is too complicated or too simple to be solved in a research. Some measure or consideration have been explained about the feasibility and how to determine whether the problem is too simple or too complicated as a part of the master thesis. Prof. Nawi, would you take this question first, or Dr.
Yeah, I'm happy to start with this. So I think the keywords is knowledge gaps. First, I think we need to identify what the knowledge gaps are. And we do that by reading. I think we are able to identify knowledge gap if we read a lot. What have been studied by other people, what have been studied in the context, what are left to be studied. So the knowledge gap. And then of course, when we know the knowledge gap already, we try to formulate questions to address the gaps. And I fully understand the dilemma. I mean, will this question be too simple? Will this be too complicated? But I think we need to start writing down the questions. I'm currently writing a research proposal for submission in almost 1.5 month time. So we defined 3 research questions, but we face the same problem as Valentina. Will this be too simple? Will this be too complicated? But then we need to write it down and then assess and discuss. We have done our homework to identify the knowledge gap. We know what needs to be done to address the knowledge gap, but the way we formulate the research question, I think, need to be repeatedly reviewed. And I believe what I'm writing today compared to the version which I'm going to submit in mid-April will be completely different, because over time we will continue revising the research question, make it more concise, make it more concrete, and over time this question will change. So first, knowledge gap, and then second, I think you need to invest sufficient time to do a lot of revision and rewriting. Okay, so don't be afraid of writing. State the question. You need to start, as I said. If you don't start, then you don't have anything to review. I hope I answer your question. I don't know.
Thank you, Prof. Nawi. Yeah. So the next questions, it's from Muhammad Faisal Alauddin. He was asking, since you have, from Prof. Nawi, since you have outstanding research experience and gain a lot of funding for the research, what part of the research proposal or study plan that should be strengthened to highlight to obtain funding?
Yes, thanks Faisal for the question. I think there are different parts that are being assessed. When we talk about research grant, I sat as a review committee for Swedish Research Council for a number of years. There are different criteria that the Swedish Research Committee put forward as the evaluation criteria. So if you submit to a certain committee or to certain funders, what is important is for you to understand how the proposal will be evaluated. So for example, in the Swedish Research Councils, they put forward the novelty and originality as an important criteria. So to get funded, a proposal needs to be novel and original and innovative. I think then you think of, you should not repeat the same question that thousands of people ask already or thousands of people study already. For example, a question, so what is the prevalence of smoking in Indonesia? If I submit this as a research proposal to any funders, I will never get funding because this is not the knowledge gap. So you need to identify question which is novel, which is original, and which is innovative. But it will be different, for example, if you try to focus on specific populations. For example, prevalence of smoking among pregnant women. We probably don't have enough data on this specific population. Prevalence of smoking among HIV patients. we don't have sufficient data on this specific population. So you can further narrow down your research question, for example. But you need to start somewhere and then start narrowing down, but also looking at the knowledge gap. So novelty, innovation, and what was the first one? Novelty, innovative, and originals. This is one of the important criteria. The other important criteria is the feasibility, as I put 2F in saffron. This is being reviewed in terms of budget-wise, in terms of applicant-wise, in terms of design-wise. I mean, if you propose a cohort study within a 2-year project, I think it will never be funded, because we know that 2 years is not enough to set up a cohort. If you propose to do an intervention and evaluate it within 2 years project, this will never be funded, because it will be deemed as not feasible. So let's say you are applying to a call of 5 years project, and you propose to conduct cross-sectional study in 5 years. This will never be funded also, because it's it's not ambitious at all. Why do we need to fund you for 5 years just to do a cross-sectional study? So I think for 5 years funding, you need at least, I would say, 3 different components. You need, for example, first to measure the burden that you can do in the first 1 or 2 years. And second, I think you need to develop an intervention, especially if the call focus on intervention. You need to develop an intervention that you can do within the second and the third year. And when you have the intervention already, I think you need to be able to implement it and then evaluate it, that you can do in the 4th and the 5th year. So I would see that as a comprehensive package of proposal. So you start by measuring the problem, developing intervention to address the problem, as well as evaluating the interventions. Of course, within 5 years, you cannot develop a full-scale implementation. So what you can do is probably to do pilot intervention and then evaluate the pilot intervention. So the expectation is that if the evaluation is successful, shows that the intervention is successful, then you would like to scale up the intervention in the upcoming proposal. So if you manage to get this fund for 5 years and you manage to develop that pilot intervention, your chance to get the next grant is much higher, because you have evidence, proof of evidence already that the intervention that you develop on small scale can work, and it's ready to be upscaled to the larger population. Okay, so I'll stop there. So these few criteria are important. Of course, there are a lot of other criteria, smaller criteria, but I would say these 2 or 3 criteria, these are the prime criteria.
Thank you, Prof. Nawi. It's about the novelty and originality, and also knowing the innovation. Sometimes it's hard for the young or early career researchers to know the gap. Now, do you have any suggestion how to, maybe they have to work with people that have a lot of experience on that, or maybe is there any possible suggestion for that?
Yes, I think everything's come with age. So when you start getting grant, then you know that you are old already. I'm joking, of course, yeah. But I think collaboration and networking is very important. So if you start developing collaborations, why not, for example, student in Gajah Mada collaborate with student in Gothenburg to do small scale project together. So you start building collaboration already when you are a student. I think that's a very important skill that you need to build already at this stage, how to develop collaborations. You're not going to kill each other because of funding, but you are going to compete a lot when you are at the right stage already of your careers. But start building collaborations, and I think mentors are very important. I can now think of a few mentors who are very important in myself in developing my careers. I can name them, and I think they play critical roles. Not supervisor, but mentors. Those who are not, to whom you do not have a formal affiliations, but they are willingly act as your mentor to guide you during the development of your careers. So, but Dr. Vicka, I think everything comes with age and trial. So the more you try, the more you know that you do not know, and then you start building the knowledge and skills on the things that you need to improve.
Thank you, Prof. Nawi. Dr. Ifta, do you have any experience that you may share about the proposal grant submissions or the challenge around it?
Yeah, so I only have limited experience about that. So So like the only grant that I did myself is like maybe worth nothing. But then it's also yeah, through that connection, and then sometimes when we are connected to some organization or name who are who have like a clear reputation, then it's easier, or maybe they will look for our proposal. Our proposal will have higher feasibility. So maybe like it's the work of a lifetime to build your reputation, and then maybe like portfolio of work. But then also it's important to collaborate and ask and consult with expert if you are not the expert in the area of the proposal. And then it is also very common now, like and increasingly, and now it's maybe the norm that you have to do collaboration and then international cooperation, and then maybe interdisciplinary apply interdisciplinary concept for your research proposal, and then it's increasingly being evaluated highly. So that's the kind of things that they see, I think. And maybe related to the other questions about like, you know, like the importance or maybe the impact of the research, it's very easy to be carried out about, you know, like the detail or the technical aspect of the proposal. But then I'm always like pulled out by the question about so what, and like who cares. So like this is also maybe one of the evaluation that we can reflect if you, or maybe like asking about whether your research question is too simple or too complicated, or is it like novel, or is it important, is like asking, so what if you know this, so what will happen, what the implication, and will people care about this problem, will it provide impact to the real health situation of some people, because we're in public health medicine. So the question is like one of the central guiding or maybe reminder for me. Thank you.
Thank you very much, Dr. Ifta. We have two more questions. I think from Sylvia, she's asking about the HDSS, but I think it's the specific procedure. It has been available in the website. Is it? Yeah. So Sylvia, you can explore in the website. And from Safira, when adopting a theoretical framework, may we take the framework or thought from the publications of international organizations such as World Bank, or should we take from the theoretical framework from the legendary theory and we develop it according to the topic of the thesis? Nawi, do you want to?
So I take this question. Yeah, I think the keywords is relevant framework. I mean, it doesn't matter where it comes from, as long as it's relevant to your research question. So, for example, if your research questions necessitate a framework on health beliefs, then you use health belief framework. If your research question necessitates framework from implementation research, for example, now I refer back to COVID-19 vaccine. Vaccination, of course, is a good program, we know, but why in some settings a vaccination program is not successful? What are the barriers and facilitators that prevent people to go to vaccination program, or maybe some healthcare services to deliver the vaccination program? So if you want to study the barriers and facilitators, then you need to use the right framework. For example, there's a framework called Consolidator Framework for Implementation Research. That might be the best framework that you could use. So to me, I think as long as the frameworks are relevant, I think wherever it comes from, it doesn't matter.
Thank you, Prof. Nawi. Dr. Ita, do you have anything to add?
So it is also my question. I think it's a good question, because I thought maybe the asker who asked this, Safira, maybe do you think like your question actually we consider about the ethical or maybe conflict of interest consideration about this question, because sometimes, yeah, we have to be aware, maybe some organization or have some ethical, maybe questionable ethical reputation of conflict of interest. But I think that's a question that I need to ask too, because I don't know the answer to that too. But then I see actually a lot of this organization, for example, World Bank, they actually develop or write a consultation or technical paper on this framework. And I see them also actually, they consult to those legendary or maybe seminal theory in this area. So I think it's also, we can evaluate whether it's appropriate or it's relevant to our research questions. Yeah. But if it's is related to ethical or conflict of interest, I don't know the answers to that. Thank you.
Thank you, Dr. Ifta. I have one more question. Some students may have a thesis exploring what kind of risk factor affecting certain outcome. And in terms of the developing a hypothesis that is simple, do you have any suggestion when the the independent variable is still exploratory, and how to make it a concise hypothesis for that? It's questions a lot of students been asking to me as well. Dr. Ifta?
Yeah, if I may address that, Dr. Ifta, do you want to start addressing that question? Okay, I can try. I think many studies on risk factors have been conducted. So I'll start with that. So if you're thinking about a risk factor for smoking, for example, there are thousands of papers already on risk factor of smoking. So to repeat another study on risk factor of smoking, I think that's probably not suggested. But then if you try to go more in-depth on the risk factor of smoking, but maybe focus on a few of the risk factors that are relevant in the setting. Let's say, for example, we know that male gender is a risk factor for smoking. I'll just use this as an example again. But which male? I mean, male is not homogeneous. So you start thinking of whether it's high socioeconomic male or low socioeconomic male, which high socioeconomic male, whether if they have good education or not good education and so on. So you try to go more in-depth into the specific research questions instead of simply asking the question more exploratively. But it's also again depend on the topics. So as I say, a question on risk factor for smoking is not novel anymore because thousands of studies has been published on that. But risk factor on COVID-19 infection, risk factor on COVID-19 hospitalization, risk factor on COVID-19 deaths. Since COVID-19 is a new disease, at least less than 2 years now, there have been a lot of studies conducted, but maybe not all study has been conducted properly. Many study relies on hospital data and maybe only on poorly designed study. I'm sorry to say, but there are a lot of poorly designed study being conducted at HAS to respond to COVID-19. But risk factor for COVID-19 in a good design study, I think that will be a good research question to be asked also. So I hope I answer your question, Dr. Vicka.
Thank you very much, Prof. Nawi. Dr. Ifta, do you have anything to add?
I think that's perfect. I don't have anything to add. Thanks.
Okay, thanks everyone. So I think this is the last discussions that we have. Thank you. Let's applaud the speakers. And just one more note that you need to start writing your thesis and the proposal especially. I think the sooner you begin and then the more feedback you get, that it will help to make it shape it into perfections. So thank you very much. I will return the sessions to the Master of Ceremony. Thank you.
Thank you very much, Dr. Vicka, Dr. Ifta, and Prof. Nawi. I'd like to invite all the participants to click the reaction button on your screen below to show our appreciation to our invited speakers today. And ladies and gentlemen, we'd like to remind you as well to fill in the attendance form that already provided on your chat box by clicking the link there. While we are waiting for some of you filling out the attendance form, I'd like to invite all of you to turn on your camera, because right after this, we are going to have the photo sessions, the virtual photo sessions. That's what I'm going to say. So let's see. Oh, there are still more than 100 participants. Thank you very much for tuning in. So ladies and gentlemen, we are still waiting for your participation. Please turn on your camera again. Okay. Let's see. We are going to divide the virtual photo sessions into 3 parts. The first parts, or the first slides, on my count, ladies and gentlemen, in 3, 2, 1, cheers. Let's go to the next slide, ladies and gentlemen. Please turn on your camera again in 3, 2, 1, cheers. Last but not least, the last slide of today's participant. On my count again in 3, 2, 1, cheers. Thank you very much for your participation. And ladies and gentlemen, obviously, this is not the last webinar coming from HDSS, Master Program of Public Health, Master Program of Health Policy Management, and of course, in collaboration with University of Gothenburg. So make sure that you are updated by following all of the social medias of FK, KMK, UGM. Once again, on behalf of the committee, I'd like to thank you very much for your participation. My name is Karisma Dewi. Stay safe and healthy. See you in the next event. Have a wonderful afternoon, everyone. Thank you.